When someone has a stroke, it's not just a medical problem, it's a race. A desperate race against a ticking clock where every single second counts. Today, we are going to decode the incredible step-by-step battle plan that doctors use to fight back. This is the Acute Ischemic Stroke Protocol.
And you know what? That's exactly what it is. Just like a heart attack, it's a sudden, life-threatening emergency that happens when blood flow gets cut off from a vital organ. Only this time that organ is the brain.
So what you're seeing here is basically a map of the brain's highway system for blood. In an ischemic stroke, the problem is devastatingly simple. There's a roadblock. A tiny blood clot has blocked a critical supply line, and now a whole part of the brain is being starved of the oxygen it needs to survive. And the response has to be just as immediate. A perfectly choreographed series of events is about to kick off, and it's all designed to do one thing: find that clot and get it out of there as fast as humanly possible.
Okay, so let's start by getting really clear on what we're actually up against. The official term is acute ischemic stroke, but like we said, calling it a brain attack really hits the nail on the head.
I love this analogy of a plumbing crisis. It's perfect, right? If a pipe gets clogged in your house, things can get messy. But when that pipe is in your brain, millions of brain cells start to die every single minute. So yeah, this isn't just a problem, it's a full-blown neurological emergency.
And that emergency brings us to the absolute core theme of this entire protocol, this relentless, non-stop race against the clock.
Now, what's really fascinating about this quote is that one word, protocolized. It means there's a script, there's a checklist for every single person on the medical team. This isn't about guesswork, it's about a well-rehearsed plan designed to eliminate any delay and make sure every single action counts.
And that race starts the moment first responders arrive on the scene. Their checklist is absolutely critical. They're getting IV access, checking vitals, doing a quick stroke screen, but the most important question they have to answer is, when was this person last known to be well? That single piece of info starts the clock. And the last step, they call ahead to the stroke center, basically saying, get ready, we're coming, and the clock is ticking.
All right, so let's follow the patient into the hospital. This is where the protocol really kicks into high gear.
This flowchart here, this is the team's roadmap. It's literally a decision tree that guides every single action, from the moment the patient hits the emergency room door all the way to the most advanced treatments. It makes sure nothing gets missed and not a second is wasted. And the very first turn on that roadmap is right here. Before they do anything else, doctors have to see inside the patient's head. Why? Because they have to rule out a brain bleed. See, the treatments for a clot are the exact opposite of what you do for a bleed. In fact, they'd be catastrophic. This CT scan is the critical fork in the road. So, once that scan confirms there's no bleeding, the protocol immediately pushes the team to the next big question. Is this patient a candidate for a powerful clot-busting medication?
And this number, this is why that last known well time is so incredibly important. For most patients, there's a window of just 4.5 hours to get these drugs in. Every minute that has ticked by since the symptoms started makes that window just a little bit smaller.
So the diagnosis is confirmed, the clock is screaming, and now the team goes on the offensive. It's time to fight the clot itself.
Doctors have two primary weapons in their arsenal. The first is the drug. Think of it like a chemical drain cleaner that's sent through the veins to dissolve the blockage. The second is the device, which is a mechanical solution where surgeons actually go in and physically pull the clot out. Now, giving that clotbuster drug, something like Tenecteplase, isn't just a simple shot. It is a process of extreme precision. The dose is calculated right down to the milligram based on weight, and it's delivered in a very specific sequence to get the maximum effect while managing the risks. But, sometimes the clot is just too big for medication to handle. For those cases, you need a thrombectomy. And this is the incredible piece of technology they use. It's called a stent retriever, and it's this amazing little device that works like a tiny mesh cage. So here's how it works. They guide this thing on a tiny wire through an artery, usually starting in the patient's leg, and thread it all the way up into the brain. Then they deploy it, open it up, right inside the clot, trapping it. And then they just pull the whole thing back out, bringing the clot with it. It's amazing.
And the result is, well, it's just breathtaking. Look at this. On the left, you see the blockage, a complete dead end. No blood is getting past that point. On the right, after the procedure, boom, the artery is wide open. Blood flow is completely restored. The change for the patient can be almost instantaneous.
So,
The clot is gone, but the battle isn't over, not by a long shot. The focus now completely shifts to protecting the brain while it tries to heal.
The care they get after the procedure is incredibly intense. The team is doing neurological checks as often as every 15 minutes to catch any tiny change. Blood pressure is kept under super tight control. Every little detail is managed to give the brain the absolute best possible environment for healing.
And that's really the power of the protocol. From that first 911 call all the way to the intensive care unit, it is a system designed for one purpose and one purpose only: to save brain tissue by saving time. Every single second that was saved, it mattered.
This entire life-saving chain of events is ready to launch at a moment's notice. The doctors, the nurses, the technology, it's all ready. But it only starts when someone recognizes the signs of a stroke, that facial droop, the arm weakness, the slurred speech, and makes the call. The whole team is ready. The only question is, are you?